think that's you.
All right, welcome, folks. We're going to get started with our keynote address today. It is my great pleasure and honor to introduce Dr. Jennifer Reich, who is a professor of sociology at the University of Colorado, Denver. Dr. Reich's research examines how individuals and families weigh information and strategize their interactions with the state and service providers in the context of public policy, particularly as they relate to healthcare and welfare. She is the author of 2 award-winning books, Fixing Families, Parents' Power and the Child Welfare System, and Calling the Shots, Why Parents Reject Vaccines. She is the editor of the books Reproduction and Society and The State of Families, and has written more than 35 articles and book chapters that explore vaccination, reproductive health, welfare, multiracial families, public assistance, and recovery after disaster. Her work has been featured in many major news outlets, including the New York Times, the Washington Post, NPR, Newsweek, and my personal favorite, the Netflix show Bill Nye Saves the World. I could say so much more about Dr. Reich's influential work on both reproductive health care and on vaccination, especially during a global pandemic. But we'd all rather hear from Dr. Reich, so it's my pleasure to welcome her.
Thank you so much for having me. I usually lead my introductions with, there's no faster way to bring down the mood in the room than to invite a sociologist. But I will say law professors have given me a run for the money. So I'm excited to talk to you today about the 2 things in my life that have been a source of passion and compulsion. I need to share it. Which is the intersections of all the many ways we can talk about. Do you want to take over? Because I'm going to make a mess of this. The many ways we can think about the way we live in regulated worlds structured by inequality. I'll start by saying it's 2023. As a reminder, time is an elusive concept these days, but we find ourselves at this moment facing a year at the long-anticipated moment where Roe v. Wade has been overturned. We're now waiting for the Supreme Court to tell us to what degree affirmative action has been banned in our ability to address historic inequalities. We're watching states enact anti-trans legislation at record speed, with rules ranging from requiring girls to submit menstrual tracking information to the reporting of gender-affirming healthcare providers and parents to child protective services systems. And of course, we find ourselves coming out of the worst of a pandemic, where medical debt is suddenly another great concern. We're finding ourselves where for-profit pharmaceutical companies who developed vaccines with public monies are now being given control of vaccine pricing and distribution again soon. It feels like many of us are fighting too many battles on multiple fronts. And for some of us, the added tax of managing young people, whether our own children or our students or the people around us that we worry about, feels some days like it might break us. I want to suggest to you today that we're actually fighting one battle. And for the next 30 minutes, I want to show you how all of these fights are tied together and worsened by a cultural insistence that we use a vocabulary of individuality and personal responsibility for problems that are collective and that allow us to ignore inequality. So many of us feel this is unprecedented, which I know is a word we're hoping to never use again. But in reality, none of these problems are unprecedented. Pandemics don't actually cause new problems. They just magnify the ones we already have. Prior to COVID, we had health disparities, and of course, they're worsened. We had economic inequality and insecurity, and that too is worse. We had depression and mental health challenges, and we are seeing how much worse that feels right now. We had teacher shortages and lack of funding for public education. We had data tracking, telemedicine. We had corporate consolidation. We had all of these things, and now they're worse. And of course, prior to Dobbs, we had a country of unequal access to abortion, laws that aimed to obstruct services, and we had unequal access to abortion services even in the same states. And of course, all of that is worse now too. So I'll start by telling you a little bit about me. I started studying vaccines a long time ago, long before it was sexy. Probably about 15 years ago, I started thinking about vaccines, and I got into studying vaccines because I had written a book about the child welfare system, and I wanted to understand more about how parents understand the state in their daily life. And I got into the child welfare system because I was really interested in abortion, and I wanted to think more deeply about reproductive choices and outcomes in the context of state surveillance. So the questions of personal freedom and state regulation have been questions that I've chased for my entire career, and they've been interconnected even as the front lines of these conversations continue to shift and change. So I'll start with the most recent enterprise on this, which is vaccines. Vaccines we can think of as the cornerstone of public health programs, but they're broadly actually understood to be a personal choice. Prior to COVID, as many as 20 to 30% of American parents were already opting out of vaccines, either choosing some vaccines, opting out of all, or creating schedules of their own choosing. At core, parents, and by which I mean almost exclusively mothers, trust their own judgment about their family's health more than they trust experts. These mothers are most likely to be white, have some college education, and higher family incomes. They also insist that vaccines are a personal choice and that they alone should be empowered to make. In the US, every state requires children to demonstrate evidence of immunization before attending school. And every state in the country allows families to opt out for medical reasons. Another 44 states allow religious exemptions, and I'll say that for a long time, West Virginia and Mississippi were the only states to do so since the beginning, and then California joined them in 2017. And I used to get a lot of mileage out of asking Mississippi, West Virginia, and California do what else in the same way as every. But since then, other states have joined in removing religious exemptions. We also have about 15 more states that allow philosophical or personal beliefs to be the basis of religious exemption, or the basis of vaccine exemptions. Now, these laws that require children to demonstrate evidence of immunization to enter schools are actually historically relatively recent. They were enacted between 1968 and 1981, and in many ways were passed as a way to gain access to new federal funds that aimed to broaden access to immunizations after evidence showed that low-income children had worse access to vaccines against polio in the 1950s. These were very much a social justice campaign built on many of the Great Society ideals, and states enacted them in ways that spread vaccine access and funding around. But it was only a few years after their passage that they came to be seen as state overreach and a sign of encroachment on personal freedoms. What we have now is declining support for childhood vaccines more broadly. What you can see is that compared to 2019 before COVID, the number of people who say that parents should be able to decide not to vaccinate their children, even if that creates health risks for other children and adults, which is the darker line, has grown significantly. And the question of whether healthy children should be required to be vaccinated in order to attend public schools because of the potential risk to others has declined in consensus. We can see this has declined almost universally across all groups, but of course we can see partisan divides that we saw throughout COVID getting deeper and broader. The claims that undergird these concerns are familiar. In fact, decades of activism for abortion regulation has insisted my body, my right, my choice, and government out of my uterus. I'm especially fond of the new edition of Don't Tread on My Uterus, which I think is a really nice appropriation of a lot of things we could unpack in that one. But what's complicated is during COVID, we saw very similar rhetoric around vaccination, much like the don't jab on me interpretation. Both movements insist less regulation and more personal freedom is the answer. COVID reminds us that we do not live alone in isolation in our personal choice. Our personal decisions have far-reaching effects on others. But we shouldn't have needed to be reminded of this. After all, reproductive justice advocates have been telling us for decades that rights are not the same as access. That without public investment and awareness of what we owe others, each person has as many options as they can afford. In fact, we know that Title X funding helps to support family planning services for 21 million of the 68 million women of reproductive age in the US. And we know that the Hyde Amendment since 1980 has shown us what happens when we don't have public investment in our reproductive lives. Medicaid recipients who lack abortion coverage, bans on the use of federal health care facilities, and even the impacts in the military or for those who are incarcerated demonstrate that we have as much choice as we have access to resources. When public support has existed, be it for vaccines or welfare or Medicaid or WIC, it always comes with regulation that is highly prescriptive, paternalistic, and aims to surveil people who use it. It also encodes for the same commitment to the ubiquitously used and poorly defined concept of personal responsibility. So one of our overarching challenges is to reimagine state support without surveillance and punishment. The rhetoric of personal choice, though, is undergirded, the rhetoric of personal responsibility is undergirded by the notion of choice. Choice is all around us, from food to contraception to school choice to public programs. Choice stands in for personal freedom and ignores that choice requires resource. The result is that an individual has only as much liberty and privacy, as we heard this morning, as they can afford. And at core, personal responsibility and choice are terms that stand in for what advocates presume is the same as fairness. After all, everyone can choose for themselves what they most want and then live with the outcomes of those decisions. And this is where law comes in, because law promises to adjudicate fairness. Rather than ensuring fairness by equalizing options, the state has become a vehicle for limiting challenges to privilege by prioritizing fairness as the same as access to resources. Resources buy choices, which buy freedoms. And as we've heard throughout the weekend, less surveillance of medical abortion, less tracking, less state are in many ways the goals of our campaigns for reproductive justice. And I will tell you that they're the same claims for those who oppose vaccines. Less tracking, fewer requirements, and less state. In some ways, this is the moment where the stories between abortion and vaccines pull apart. Vaccine opponents are fighting for the right to be free of responsibility to others. They insist everyone should live in their privacy and ignore the harms they might do to others, including those who have underlying health conditions, are too young or too old to be immunized, or those who are susceptible to the worst outcomes of infection. Abortion is different. Even before trap laws, before Dobbs, we know that without public support for contraception and abortion, not everybody can access rights even when available. For many, Roe was already irrelevant prior to Dobbs. Abortion was already expensive and inaccessible, and although not new, clearly Dobbs has made everything worse. Now, one important difference that I think is worth highlighting when I think of the similarities is also to think of the differences. At core, pregnancy is not contagious. And when we think about the limitations of privacy, it becomes most clear when we talk about diseases that spread throughout communities. But we're here today to talk about health equity and law after Dobbs. And that brings us back to abortion, which brings us back to vaccines. So what you may not realize is that vaccines and abortion have been inextricably linked for decades. In many ways, our story starts in the 1960s when researchers, galvanized by the success of the polio vaccine and by antibiotics, set out to solve other infectious diseases. To make most vaccines, researchers have to continue to replicate a virus over and over again on tissue until it's weakened, mutated, or killed. The challenge is that not all viruses grow on all tissue. So while the polio vaccine was made on tissue from kidneys of monkeys, not all viruses replicate on animal tissue since not all viruses affect animals. The solution came in 1961 when American researchers gained access to cells taken from fetal tissue. The tissue originated at the Wisteria Institute in Sweden and known as the WI38 cell line, from a fetus that was genetically female and was aborted by a healthy woman who felt she could not manage an additional child. The scientists who created the WI38 cell lines from a single abortion shared those cell lines across the world for researchers who were developing new vaccines. And that resulted in vaccines against rubella, rabies, and oral polio that are still used today. In 1966, British researchers created a second cell line from tissue from an aborted fetus that was male. Scientists use this line to create vaccines against hepatitis A, chickenpox, and shingles. 2 additional fetal cell lines were created in the 1970s and 80s in the Netherlands and are used in a range of pharmaceutical and consumer research, including ibuprofen, my drug of choice, acetaminophen, aspirin, blood pressure medication, diabetes management, and were in fact used to help create the Johnson & Johnson vaccine and to test the efficacy of the Pfizer and Moderna vaccines against COVID. Fetal cell lines help produce vaccines, but vaccines have been essential in protecting fetal health. They also play a significant role in the history of abortion politics. First, infectious disease is bad for fetal development. Rubella or German measles is the clearest example. Rubella is a virus that causes flu-like symptoms and sometimes a rash and fever. However, when a pregnant woman is infected with rubella in the first 3 months of pregnancy, her baby can be born with congenital rubella syndrome, which is marked by cloudy corneas or white-looking pupils, blindness, deafness, developmental delay, intellectual disability, seizures, and small head size. An outbreak of rubella in 1964 is believed to have caused 20,000 cases of congenital rubella, resulting in 2,100 neonatal deaths, 11,600 cases of deafness, 3,580 cases of blindness, 1,800 cases of intellectual disability, and 11,250 miscarriages and abortions, both spontaneous and elective. Rubella is not the only infectious disease that presents risk to fetal development. A woman infected with chickenpox or varicella early in pregnancy carries a 2% chance of a fetus who may have scarring to skin, limb deformities, eye damage, or intellectual disability. Infection can lead to spontaneous abortion and increased risk of death in infancy. Measles, too, can cause miscarriage, premature birth, and birth defects. Prior to COVID, estimates were that vaccines prevented about 5,000 miscarriages each year. The SARS-CoV-2 virus, which is responsible for the pandemic, also increases risk of miscarriage. The vaccine served a second important role in abortion politics, though. Prior to Roe v. Wade, women could in many states only gain access to abortion with the permission of a hospital review board. Women commonly explained that they had been exposed to rubella as the reason they requested an abortion. Getting permission was cumbersome and often humiliating. Doctors were reluctant to grant access to abortion in most circumstances and presumed that women were lying about rubella exposure to obtain that abortion. Historian Ricky Solinger analyzed records from these hospital boards to illustrate the challenges women faced in requesting abortion services. She said, 2 women who had contracted rubella, one at 6 and one at 9 weeks of gestation, applied for permission to abort, but were rejected by the committee because in both cases the illness was not objectively observed by a physician. For doctors who aimed to limit access to abortion and who showed disdain for the women who requested them, a vaccine against rubella promised a solution. Because the benefits of vaccines to fetuses are not controversial, religious organizations are behind immunization, even those vaccines created with fetal cell lines. The Vatican and the Southern Baptist Convention, for example, have been vocal supporters of the importance of vaccines, with the Vatican explaining that all vaccinations recognized as clinically safe and effective can be used in good conscience with certain knowledge that the use of such vaccines does not constitute formal cooperation with abortion. And similarly, the Southern Baptist Convention also recommends immunization, explaining that if abortion were conducted in order to harvest tissues to be used as a vaccine, that would be immoral. But in the case of the vaccines, the abortion was carried out for other reasons, and the tissue was acquired post-mortem for the purposes of research. They likened it to murder and organ transplantation, that to receive an organ from a murdered person would not be the same as having participated in that murder. On the surface, we might assume that proclamation from major religious organizations with passionate opposition to abortion would settle the question on vaccines use as it relates to abortion politics. But in a culture where individual choice and personal responsibility reign, and vaccines are simply one consumer choice among many, these reassurances have actually done very little to reassure or quell rejection of childhood vaccines. In fact, anti-vaccine activists draw on anti-abortion politics to malign vaccines and those who use them, as do anti-vaccine activists. So as we continue to explore the way that Dobbs and COVID and abortion and public health are all interconnected, I want to spend a little time explaining how abortion politics are mobilized to undermine vaccine consensus and what this means for a range of possible problems in the future. This is notably not an exhaustive list of how abortions and vaccines are intertwined, but rather my goal is to show you how these are woven together into a coherent attack in hopes that you can spot it moving forward and advocate against it. So the first claim that we can see is that those who use vaccines are morally corrupt because of their relationship to fetal tissue. This is a strategy that's often used to mobilize the emotional response of disgust in the relationship. One anti-abortion organization explains the moral culpability in abortion that results in vaccine and thus the use of vaccines. The fact of the matter is that ascertaining moral culpability, it's not just the mother's intentions that must be considered. There are three parties involved: the mother, the abortionist, and the researcher, all of whom share equally in the intrinsically evil act. We know it is the intention of scientists to destroy embryos for research purposes, and likewise, it was the full intention of both the attending abortionist and the researcher present at the foot of the abortion table to destroy those babies specifically to create vaccines. Parents I interviewed in my research frequently cite the use of fetal cells in their explanation of their objection to vaccines. One mother explained to me the chickenpox vaccine has evil human cells of aborted fetuses, and a lot of Christian people I talk to are just amazed that this is happening, and they don't even know it goes against their sense of what's right, but they're not even being told what they're doing. These claims have been mainstreamed by celebrities, including Kanye West, as examples of the ways these get linked together, that when we stop and look at them, they seem like divergent topics, but are explained interchangeably. Moral outrage gets built upon as activists insist that the very use of vaccines is akin to cannibalism. One blog writer asked rhetorically, isn't the definition of cannibalism the intake of flesh, blood, or some body parts of your own species? How much of a difference is there between eating human tissue and allowing it to be injected straight into your bloodstream? Of course, there's medical emergencies where people need blood or organ transplants and adopt another person's blood or tissue to survive, but vaccines do not fall into this category. On the surface, this claim sounds wacky, but it's in fact powerful, and the power is twofold. First, it accepts that fetal cell lines are the equivalent of a person. It allows us to feel some level of disgust on an emotional level. And second, it uses images of what's culturally considered a repulsive practice to create a moral boundary with those who support vaccines and abortion on the wrong side of the boundary from everyone else. As anti-vaccines continue to advocate against the use of vaccines by drawing on abortion imagery, the latest contribution to the conversation is to blatantly attack LGBTQ+ communities generally and trans children specifically. Rather than simply questioning the morality of parents who consent to vaccines, some blame the increased visibility of trans children on vaccines themselves. In doing so, both vaccinating parents and children are condemned, with abortion to be blamed. One often reprinted post explains, how does human DNA in vaccines contribute to the rise of gender identity confusion? WI38 is a cell line from a female aborted fetus used to cultivate viruses in vaccines. When you inject DNA from a female carrying 2 X chromosomes into a male who already carries 1 X chromosome and a weaker Y chromosome, you now have an overload of the X chromosome. Now we have an onslaught of boys, and I feel like every time I say this, you should know it's in all caps, boys who think they should be girls. Do we have male DNA vaccines? Yes. MRC5 is the code given to the fetal cell line used to cultivate viral components, and it comes from a male aborted fetus. Do we have girls who think they're boys? Yes. Is it as prominent as boys wanting to be girls? No. Why? Because girls have 2 dominant X chromosomes. When they're injected with a vaccine containing MRC5, they're just getting a Y chromosome, but yet another dominant X chromosome on top of the 2 they already have. That's why you don't see as many girls wanting to be boys as you do the other way around. Another post asks, could vaccines containing female DNA from aborted fetuses be creating gender confusion? The author answers her own question, asserting that no health authority has researched this. Your babies are the experiment. The website for Christians for Truth explains, get rid of dangerous and ineffective vaccines and you will greatly reduce gender confusion in children. But we can't have that. And even if vaccines were shown to cause transgenderism, and the LGBT community would come out firmly behind increasing vaccination rates for children, as it would be yet another way to increase their numbers. These claims, sometimes it's hard to use a straight face. These claims are tightly woven with racism, misogyny, homophobia, and anti-Semitism. One online comment references the number of Jews who work in research and education. Yep. Yep, Jews sell vaccines and run the transgender propaganda machine. These kids, they have kids coming and going, and you want to argue which tentacle of the Jewish octopus is most lethal? That sounds like Talmudic hair splitting to me. The linkages between abortion, science, and public health are at core a battle over the meanings of gender. Discredited physician Ben Marble, who opposes vaccines and formed a telemedicine clinic to offer COVID alternative cures, illustrates this in an interview I listened to. They want to claim a man's a woman. This is the whole root of their fake science. You know, PC, commie, fake science. Claiming a man can get pregnant, claiming a person can change their sex. Well, that's fake science. No person can change their sex. You are whatever you're born forever. You can have genital mutilation surgery, take all the hormones you want, but that does not change your sex. You know, genetically, you're XX, you're female. But if you're XY, you're male. Anything else is a genetic abnormality. So there's trying to cite abnormalities as claims, and there's really more than two sexes, now. That's just a lie. And so they claim men can get pregnant. People can change their sex, and then they claim poison as a vaccine. They're fake science, that's their fake science, and they're pushing it on the masses. They've perfected the psychology of how to mass brainwash people over the past 100 years. And fear is the key. Make people afraid, and you've convinced them to do just about anything. So after Dobbs, at this moment, what should we expect to see? So I want to give you a few of my expectations as a sort of cautionary tale and warning. First, we have culturally doubled down on the frames of personal responsibility and individual choice. This has paved the road to increased religious exemptions. Courts have broadly accepted that any claim, even if built on hate speech or false information, is acceptable if it's in the name of religious freedom. In my research, I saw parents offer each other advice on how to get out of vaccine requirements by claiming religious reasons. For example, one mother advised another, if the MMR moms used aborted fetuses or something, you might be able to say it's against your religion. I don't remember which one has it, but even being Catholic, you could probably slide out of that one. Another mother worried that she had already started vaccinating and therefore may have surrendered her right to a religious exemption. And another mother assured her, you can always find Jesus. What's important to note is that these parents do not see themselves as harming others. Rather, they see themselves as the victims whose personal choice is in jeopardy. One mother explained in an online community, the worry about getting into schools, having to be careful about how we formulate our religious exemption letter, the constant politics regarding consent in schools. It's awful. I feel like I'm walking on eggshells sometimes. I just hope that people can humanize everyone's personal choice and leave it alone. This rhetoric is common and persuasive. Second, we should expect more full frontal attacks that mimic trap laws. Just as we are already seeing efforts to criminalize medications that can be used in abortion, vaccines are also under attack. This month, Idaho and North Dakota introduced bills to ban the administration of mRNA vaccines. North Dakota's would ban the administration. Idaho's would make it a misdemeanor to give an mRNA vaccine to any mammal. So we can presume that should the rabies vaccine using mRNA technology that's currently being tested to be proved successful, that would also be banned. These states already have amongst the lowest vaccination rate in the country, with Idaho, for example, at 56% of people getting 2 doses of a COVID vaccine compared to 80% of the as a national average. But more importantly, these laws mimic anti-abortion legislation that criminalizes healthcare providers' work and judgment. Whether states can limit access to FDA-approved medications, vaccines, and devices, of course, remains to be seen. But that is the model that is proving successful in other areas and is being imported into this world to create, if nothing else, public confusion about what options are for care. Third, we will see more laws that aim to undermine social justice campaigns by flattening the concept of civil rights. More than half of states in the last 2 years have considered legislation to define unvaccinated people as a protected class. These laws forbid government and private entities from discriminating based on vaccine status. So far, Montana is the only state to have passed such a law. Efforts to make inequality the same as personal choice and behaviors the same as group membership are significant. At core, it erases race and sex as protected classes by extending it broadly. This is not an accident. One supporter of a bill in North Carolina explained, "It's nothing other than a civil rights issue. It's no different from no vax, no service, no different from no whites, no service, no different from no blacks, no service, no different from no trans, no service. It's the same thing. It's discrimination." Not only that, they put the non-masked people on one side, they put the masked people on the other side. This is no different than the Civil Rights Act of 1964, which is a law that protects all of us and our liberties. The use of civil rights language to undermine other groups is extensive and expanding. State laws to ban abortions upon detection of embryonic cardiac activity as early as 6 weeks of gestation, known as heartbeat bills, draw on a civil rights framing, claiming that fetuses should be protected with civil rights just like those of Black or LGBT Americans. One Georgia legislator successfully advocated for such a law. First, he insisted passing a law prior to Dobbs that contradicted Roe v. Wade was within the state's rights. If you think back to the same-sex marriage debate, the state of Massachusetts recognized the franchise of marriage more expansively in Massachusetts than the minimum requirement of federal law. This is walking the same tradition. In pointing to how Roe was a mistake, he also likened embryos to Dred Scott and asked legislators to define fetuses as not 3/5 of a person, but a full person in law. Fourth, we will see aggressive efforts to enact legislation to remove protections from some groups in the name of supporting individual preferences, masquerading as rights of others. This will most aggressively attack those who already lack power. Conscientious objection laws have for a long time used the Religious Freedom Restoration Act to allow individual healthcare providers to opt out of providing abortion services or to protect pharmacists who refuse to fill prescriptions. These laws will continue to broaden, to deny care to trans people and queer people. We've seen them with PrEP medications. We've seen them with HIV medications. We've already seen expansive to other groups. And this too will soon affect vaccine distribution. States are already working to weaken existing non-discrimination laws that prevent employers, businesses, or hospitals from refusing services and care. And that too, I expect, will broaden. The 2023 legislative session has already seen more than 300 bills aiming to restrict LGBTQ people, targeting their freedom of expression, their safety, the safety of transgender students, and access to gender-affirming health care. For comparison, in 2022, the ACLU tracked a total of 278 bills. So while fetuses and unvaccinated people are gaining civil rights, women, people of color, and trans people are losing them. Oh, I gave you some more pictures I could have. I'll end by saying that when I was thinking back on times, I vaguely recall feeling happy in December 2019, thinking naively that 2020 was going to be a great year. I admit I absolutely lacked the imagination for where we would end up. And now in 2023, in a new year, I have no such delusions. I am clear that our collective efforts to address inequality are under siege. As we draw the connections, we have to acknowledge that most of these attacks are waged on young people. Vaccine mandates that protect children's right to an education and to be safe in school, abortion rights, attacks on trans people that focus on schools and sports, attacks on affirmative action and critical race theory and history all target young people. It's in fact no wonder that the CDC report last week, using data from 2021 before the Dobbs decision, found that young people are not okay. For those who didn't look, the report says that 3 in 5 girls felt persistently sad, hopeless, up from nearly 60% in 2011. For LGBT youth, the story is even worse. In 2021, almost half of LGBTQ+ students seriously considered attempting suicide, and nearly 1 in 4 did. Nearly 3 in 4 expressed persistent feelings of sadness or hopelessness. More than 1 in 10 LGBTQ+ students said they did not go to school because of safety concerns. Nearly 1 in 4 experienced sexual violence, and nearly 1 in 4 were bullied in school. These attacks are interconnected, infuriating, and exhausting. Much of these interconnections rest on connecting these disparate battles into one coherent movement for all of us. We should watch for claims of religious freedom that insist that others' efforts to live their authentic lives are a harm to them. We need to watch for the way that public health is reduced to a series of consumer choices available to those with resources: vaccines, HIV prevention medications, trans care, contraception, abortion. And above all, we need to watch for the ways that we are encouraged to see each issue and movement as separate and even in competition. Our final challenge is to remain vigilant and united in how we face racism, misogyny, anti-Semitism, homophobia, and ableism together. We have to avoid using vocabulary that furthers inequality, even as public agencies and sometimes funding agencies encourage it. Vaccine rejection, for example, is largely based on an ableist logic of whose lives are valuable and whose bodies are damaged. At times, efforts to fight for abortion or to show the horrors the Dobbs decision is already creating look to the widespread acceptance that disability is a good reason to terminate a pregnancy, as if all reasons are not good ones. The road ahead is long, and the burden of carrying this battle will be heavy, but we also know that many hands can lighten the load. And that in solidarity, I have confidence and even, let's say, 2023 optimism that together we can do great things. And I'll stop there.
So we can take questions now.
Laura, yeah?
I'd like to ask your thoughts on. Press the button. I'd like to ask your thoughts on sex education, which seems such a part of this parental rights fight.
There were moments in the Trump administration where I thought, how strange that we're looking to the states as the champion of civil rights and protections in a way that we've mostly looked to the federal agencies and government to handle, right? And now we're at a different kind of administrative impulse and a different moment to sort of think of this combination. Sex education at heart, right, comes to this question of what does local control mean and what does relevance mean and who gets to control that information. It's interesting we're not talking as explicitly about sex education right now as we are about critical race theory and the AP exam, right? That the battles of what children should know and be taught is so far removed from the typical battles we've been accustomed to about what does it mean to take care of one's body? What does it mean to grow up with a sex-positive ethos or to think of pleasure as part of sexuality? What does it mean to know you have choices? And so there's a couple ways I think we can think this through. The challenge of regulation, I think we're not going to get outside. And we know that without public supports, many things are unavailable. So one of the things with that showed up in COVID data were that when schools recommended COVID vaccines, parents were more likely to vaccinate their kids, and higher income schools were more likely to recommend it. So we started seeing class differences even in parents' understandings of COVID vaccine availability, access, safety, and its role in the community. That's stratified across class. And I think for sex education, we can see some similar patterns, right? That empowered parents will advocate or quell the kinds of curriculum that they want to see in the schools, and then the state becomes a backstop for what we want to see move forward. That's a very circular answer to a question, right? That's going to be really hard as we move forward. Yeah, Thomas? Sorry.
Hi, my name is Hannah. I'm with the DC Abortion Fund. One question that I had is around the idea of silos, particularly like our internet black holes, right? And so a lot of what reporting has been done post January 6th is like the idea of how invested people got in the internet silos that they were in. So like, how do you think that plays a role in vaccine ideology?
Yeah, thanks for that. You know, one of the things I became really concerned about during COVID was how hard it was to have conversations with people you didn't already know or agree with. That there were no people on airplanes, there were no people at bars and restaurants that you have casual conversations with that can even provide additional information or perspective. That even coming out of that, I think many of us are seeing that spontaneous in-person conversations are hard to stumble upon at this moment, this conference being accepted. And so that definitely allows people to become more attached to their belief systems. What we know of vaccines, for example, is that vaccine hesitancy clusters, that the best predictor of who doesn't immunize their children is the number of people they know who also don't immunize their children. And on one hand, you'd think, well, birds of a feather, find each other. But no, it actually is a radicalizing process. So when you take a parent who's not critical of vaccines and they enter a school, for example, like a Waldorf school that has a very low immunization rate, they become more critical of vaccines. And I heard this often in my research. But the flip side is when they enter communities where the norm is different, it also causes them to question their hesitancy. And so we have to think about, I think, some of those information things. The challenge, of course, in the digital environment, as we heard this morning, is the ability to narrowcast messaging can further a lot of these challenges. And I think that's one of the additional sort of digital privacy problems that this morning's panel covered pretty well. Did you want to?
I think it's a pretty similar vein, but I guess I'm just wondering about where the value of personal relationships ends up in this. And I'm thinking about, there was a study a while ago, Liqueur, that got blown up because he said if folks who were LGBT knocked on doors, folks would change their votes if they engaged in that storytelling. And then there was a later study that actually affirmed that even though he was dubious, that the idea stands. And so as we think about the sociology moving forward, and the talking about the abortion diaries and talking about storytelling, is there value in us reconnecting individually, maybe off the internet, and trying to move this conversation or the way that we engage with each other?
Yes. No. Is there value in communicate? Yeah. It's interesting that I'll give these like very elaborate, social reads on vaccines, and everyone's just like, so what do we do? Tell us the answer, and I think because we all want to know, how do we move people around us? And you're right, these studies on boundary work that looked so promising have been maybe overstated. Having said that, what we know is that people trust people who share their values, their lifestyle, and their ambitions. And we are no exception to that. And so parents, for example, talk to other parents a lot. They want to know how you get your child to eat more vegetables, which teacher should you request next school year, Which summer camp are you sending them to, right? These consumer choices, people share and pool information about them. And vaccines are part of that process. And arguably, we could also think about the possibilities of abortion and family planning being part of that process of empowering parents to talk to other parents about their experiences and choices. What we know doesn't work is, and I'll just say I spend a lot of my free time fighting against the medical literacy model. Like, if only we educate people, they'll make great decisions. And I confess all the time that I am not confused on the nutritional properties of ice cream, but I like it very much, right? And so it's not a health literacy problem. What works is not bludgeoning people with facts, telling them statistics, trying to convince them that statistical risk is meaningful. Statistics are subjective, even if they have I'm looking at The Economist, they have an empirical meaning, but their experience is an emotional one. And so if I say you have a 2% chance of a birth defect with chickenpox exposure, is that high or low? What does that mean to you in your life with your values and your experience? It turns out what's really helpful is explaining how you got to this decision, explaining your own process. And I think there's many people in this room who have children who had a moment of hesitation taking your own child to the pediatrician. There is something about commission that's harder than omission, and acknowledging that, and this is how I made those choices. This is the thing that got me there, can sometimes be a linkage to hearing where people's own anxieties. And then the final thing I think is really hard in this front, and I feel it more with anti-abortion activists and anti-vaccine activists, is starting with the assumption that people want healthy children and healthy families and healthy communities. And that if we start with that we assume people are doing the best they can with what they have, how do we then start to find those linkages about what you want for your kids and what I want for your kids, right? And where are our commonalities that we can communicate across? And that can be a place sometimes for dynamic change. Also, I'll just say sometimes it's not we think it's like I'll knock on a door and it's done. And it turns out that these are not one-time decisions. People's circumstances change, their opportunities change, and their decisions change. And I heard that from parents a lot. This is not a one and done moment. That as they approach international travel, their child wants to be a missionary. There are reasons that they may revisit choices, and that continuing to be open to dialogue is one of those possibilities to allow them to make change.
Hi, kind of to piggyback on that, I think, have you had any kind of conversations with people, or maybe there's been studies about the impact of shame on communities as people try to change or move in their beliefs around this?
Around vaccines?
Yeah, around vaccines.
Yeah. And that's part of that clustering and social norms piece, right? That if you are someone who's hesitant and you enter a community where the norm is to immunize, it becomes highly stigmatizing. And I heard that a lot, that parents control information. Mothers-in-law get a special shout out a lot in research, that like a mother-in-law is often your biggest problem in decision-making. But it depends where you are. I think one of the byproducts of COVID, and this maybe goes back to some of the social media questions, is that there's been, in those images, I've been studying the relationship between fetal tissue and vaccines for a long time, and the stuff about cannibalism and transgender children showed up during COVID. Like the amplification of possibility and then the ability to sort of cast that widely. I'll say that the worst thing I did for my mental health during COVID was listen to over 300 hours of anti-vaccine webinars, and how much that the ability to create subscription platforms to offer these opportunities to sell them, they're free for 12 or 24 hours. So you have to be all in for like a 3-hour webinar every 24 hours, right? That's a certain kind of resocialization activity. And so thinking about what that does to make it seem more normative, that having this broader community that you don't know, but that guy in Florida who's selling you something is 100% behind you, as are the people on the chat screen, you can now feel, I think, more supported than you might have if your only community was that Thanksgiving dinner where everyone thinks you're the person who's not a good parent because of this.
Thank you. Just a quick question. How do you think like initial hesitance, the fact that we didn't test the COVID vaccine with pregnant people, right? So then it was like, well, we don't know. And now we know COVID infection can really mess up that fetus and cause miscarriage or stillbirth. And how do you like go back and fix the original messaging?
Yeah. So one of the other things I do for my mental health is I stream a lot of federal advisory board meetings about vaccines, and for both the ACIP and VRBPAC for the FDA. And what was the most fascinating thing in fall 2020, when the vaccines were coming online, was listening to a room of almost exclusively white physicians, researchers, and epidemiologists discuss distribution priorities. And I feel like I'm going to cause PTSD when I say this, but do you remember the group A, B, 1A? Do you remember this, like, we were going to prioritize vaccines? Within 3 weeks, 70% of states had already abandoned this model. And so it was a regulatory failure. And part of it was that it was a social determination being made by people who aren't social scientists, right? That they were treating this as a medical fact, but then they had two goals: save lives of people who are vulnerable and keep core institutions operating by giving them to essential workers first, with no definition of what's an essential worker, by the way. And so you have these, and there's the Venn diagram of people over 75 and essential workers are two unconnected circles, right? And so there's no way to do that at a policy level, but that was the medical recommendation. And thinking about, to your question about pregnant women, right? We have a long history of excluding pregnant women from research, in some ways because of some problematic past research. And I'll say, like, this group is also all in on familial, like, they want to talk about some of the medications that were bad for pregnant women historically as a further example why vaccines should be resisted. Like, they'll draw on medical and pharmaceutical histories in very reasonable ways. And so thinking about, do we wish that was true? So one of the things, going back to my ACIP moment, is that there was data presented that people of color were dying of COVID at greater numbers and younger numbers than were white Americans. And so this group of white scientists said, maybe we should give vaccines to people of color first. And you could imagine that story not working out based on our history. Like, we have an experimental vaccine, we came up with it pretty quickly, we think it works fine, let's give it to those people, like the groups of people of color first, and right? So this idea that was driven by a scientific fact was politically impossible. And it brushed up against also the sense of fairness that would have been intolerable at a federal regulatory level. And in many ways, the pregnant woman story is the same, right? Which is like, we can see this. Like, PBS did an amazing documentary in the first couple months of a pregnant woman in the ICU because of COVID, right? And what was happening to her baby. Like, we knew this was on the thing. And yet this was the same, like, we're going to be colorblind, we're going to be resistant to this whole sort of vocabulary, and then therefore we have to erase the vulnerabilities that we can see, right? And these data policy nexus problems, I think, are fascinating and complicated. And sometimes it's also a byproduct of who's in the room to make these decisions. And I'll say the other piece of this is, of course, how much energy was spent really questioning the relationship between fertility preservation and vaccines. Right? And the fears that were really pushed out rapidly that couldn't be well answered initially. And I think that absolutely was a driver as well.
Please join me in thank you.
Well, that was frightening, fascinating, and I don't know. I think it's a tough competition about who can say the scariest things. You also teed it up beautifully for our next panel, which is on the First Amendment and freedom of religion. So we'll be talking about some of the arguments you raised. So we'll start again at 1:40. So see you soon.